In this tutorial, we will review neonatal fluid and calorie calculations. This worksheet provides the methods used for some of the more common calculations performed in the NICU. The examples below show calculations for total fluids and caloric contribution for enteral and oral feedings, as well as IV infusions and glucose infusion rate. The last examples demonstrate how to calculate feeding volumes or IV infusion rates to achieve a desired total fluid target. In addition to examples of calculations, there are also practice problems for each scenario. There are a couple of general principles to keep in mind with fluid calculations. First, while feeding volumes and IV fluid rates are practically ordered based on milliliters of milk per feed or milliliters per hour of fluid, it is more important to know the volume of fluid per kilogram of body weight per day that an infant is receiving. Second, given that this concept is based on the weight of the infant, it is important to use the appropriate weight. In general, the weight of most infants will decrease following birth. It is important to use the infant's birth weight until she has regained or surpassed her birth weight. We'll first look at enteral feeds or tube feeds. With this feeding method, an ordered volume of milk is given to the infant at each of their feeds throughout the day through an enteral tube. In our unit, feeding frequency is typically every 3 hours. This provides 8 feeds per day. To calculate the total fluids per day in milliliters per kilogram per day, you take the volume of the NG feed, multiply it by the number of feeds per day, which is 8, then divide this by the infant's weight. Let's look at an example. Baby A receives 30 milliliters of breast milk fortified to 24 calories per ounce via NG tube for each of her feeds. After surpassing her birth weight of 1.5 kilograms, the infant now weighs 2 kilograms. What is her total fluid intake per day, and what is the total caloric intake per day? Again, to find the total fluids per day in milliliters per kilogram per day, we'll take the volume of the feed, in this case 30 milliliters, multiply it by the number of feeds per day, which is 8, and then divide it by the infant's current weight since she has surpassed her birth weight. This gives us total fluids per day of 120 milliliters per kilogram per day. To find the total calories per day, we can take the total fluids and using conversion factors for the number of calories per ounce and the ounces per milliliter, we can get to the total calories per day. In this case, we'll take 120 milliliters per kilogram per day that the infant's receiving, multiply it by the caloric density of the formula, here 24 kcals per ounce, and then convert from ounces to milliliters. Working the numbers and canceling the units, we're able to get to total calories per day of 96 kcals per kilogram per day. We'll next work on a practice problem. In this practice problem, baby A receives 10 milliliters of unfortified breast milk every 3 hours, giving her 8 feeds per day. Her birth weight is 3.2 kilograms. We're asked to find the total fluids per day and the total calories per day. So we'll take the volume of the feed, which is 10 milliliters, multiply it by the number of feeds per day, and that gives us a total of 80 milliliters of fluid in the day. We need to divide by the weight, which is 3.2 kilograms, and this gives us a total fluid intake of 25 milliliters per kilogram per day. To get to the calories, we use the conversion based on the caloric density. So we take 25, multiply it by the density, which is 20 kcals per ounce, and then we get to milliliters. 1 ounce is 30 milliliters. When we cancel the units, we'll get to the answer of 17 kcals per kilogram per day. We'll next look at oral feeds. With this feeding method, the infant is able to regulate the amount of milk he takes at each feed. The total fluids per day is simply the sum of the feeding volumes in milliliters divided by the infant's weight in kilograms. Let's look at an example. Baby A is taking NICU, which is 22 kcals per ounce, from a bottle. He eats every 3 hours, so there are 8 feeds in a day. The feeding volumes in milliliters were 20, 25, 30, 25, 20, 25, 30, and 25. His current weight is 2 kilograms. What are his total fluids, and what's the total caloric intake? To find the total fluids, we simply add all 8 feeds that he had during the day, and then divide by his current weight. When we do that, the total fluids per day come out to 100 milliliters per kilogram per day. Again, to get to the calories, we take the total fluids per kilogram per day, multiply it by the caloric density and the conversion factor needed to get to kcals per kilogram per day. Here, the baby receives 73 kcals per kilogram per day. We'll move on to a practice problem. Using the ins and outs table, you see that baby A took 380 milliliters of NICU 22 kcals per ounce yesterday. His current weight is 2.5 kilograms. We're asked to find the total fluids per day and total calories per day. So in this case, we take the total volume of feeds, which is 380 milliliters, and we simply divide it by the baby's current weight, 2.5 kilograms. Which gives us 152 milliliters per kilogram per day. To get to the total calories per day, we'll take the total fluids, multiply it by the caloric density of the formula, and the conversion factor for the units. Cancel units and work the math. We get 111 kcals per kilogram per day. The next scenario that we'll look at is infant-driven feeds. With this feeding method, the infant is given an opportunity to orally feed if she shows appropriate feeding cues. If she does not demonstrate those cues or does not finish the ordered feeding volume, then the milk is delivered via enteral tube. In our unit, this method is typically used as premature infants transition from tube feeding only to being able to take full feeds by mouth. We are interested not only in the total fluids and calories as in the previous examples, but also the percentage of total volume taken orally. When an infant is able to take more than 80% of their feeds for 2 days in a row, then her enteral tube can be removed. To find the total fluids per day, again in mils per kilo per day, we can take the ordered feeding volume because we know that the infant is going to receive this whether they take the full volume by mouth or whether they take part of it and the other half gets put in the tube, or if they don't demonstrate the feeding cues and the full volume gets put in the enteral tube. So the ordered feeding volume times the number of feeds per day divided by the infant's weight will give you the total fluids per day. To find the percent of oral intake, we simply take the volume of oral intake that the baby took and divide that by the total feeding volume, multiply by 100 to get a percent. Let's look at an example. Baby A is ordered infant-driven feeding 40 milliliters of Sim Special Care High Protein, which is 24 kcals per ounce, every 3 hours. Her interest in oral feeding is improving, and in the past days she took the following volumes in milliliters: 20, 25, 25, 30, 30, 35, 40, and 40. Her current weight is 2 kilograms. We're asked to find total fluid intake, caloric intake, and percentage of oral intake. For the total fluids per day, we take the feeding volume as we have in previous examples, multiply it by the number of feeds per day, and divide it by the baby's weight. In this scenario, the total fluids per day is 160 milliliters per kilogram per day. To get to the calories, again, we multiply by the caloric density of the formula and the conversion factor to get to milliliters. Here, the total calories per day, 128 kcals per kilo per day. To get to the percent oral intake, again, we simply add what the baby took by mouth at each of her feeds. You can see here in these two feeds, the baby took the full amount by mouth. Here, she only took half. So we add those numbers up, divide by the total volume of feeds, 40 milliliters times 8 feeds, and then multiply by 100 to get the percent, 77%. Let's work through a practice problem. Baby A, who weighs 1.5 kilograms, is just beginning infant-driven feeding. She's ordered 30 milliliters of maternal breast milk fortified to 24 kcals per ounce with human milk fortifier for each of her feeds, which occur every 3 hours. In the past day, she's demonstrated oral feeding cues at 4 of her feeds and took volumes of 5, 15, 10, and 15 milliliters. We're asked to find the total fluid intake per day, the total calories per day, and the percent of oral intake. So here, for total fluids per day, she's ordered 30 milliliters at each feed. There are 8 feeds in the day. She gets a total of 240 milliliters of fluid, but we have to divide by the weight, 1.5 kilograms. This gives total fluid intake that we guarantee of 160 milliliters per kilogram per day. To get the total calories, again, we multiply by the caloric density of the formula, 160 times 24 kcals per ounce times the conversion to get to milliliters. And this gives us 128 kcals per kilogram per day. Now to calculate the oral percent intake. Oral volumes, 5, 15, 10, and 15. Adding those together, we get 45 milliliters. We know that the total volume that she was ordered was 240. So we can take 45 divided by 240, multiply that by 100 to get the percent, and her percent oral intake in this problem is 19%. Now let's move on to look at IV fluids and TPN. Many infants are NPO for a variety of reasons and are receiving IV fluids only. These IV fluids encompass TPN, line flushes, clear maintenance fluids, including things like D10W or D10E48, and drip medications such as dopamine and morphine, just to provide a few examples. All of these continuous infusions with their individual rates are added together to determine their contributions to the total fluids an infant receives in a day. Bolus medication infusions such as antibiotics or scheduled pain medications are not added to this. When determining the calories for these fluids, only the contribution of TPN is really important, as clear maintenance fluids are not a significant source of calories. The calories present in a bag of TPN can be found in the medication report for the TPN. To find the total fluids per day for an IV fluid, we take the IV fluid rate in milliliters per hour and multiply that by the number of hours in a day, 24, then divide by the infant's weight. If there are multiple IV fluids, then we can add the rates for each individual IV fluid. IV fluid 1's rate plus IV fluid 2's rate, then take that total rate, multiply by 24 hours, divide by the infant's weight. Let's look at this example. Baby A, who now weighs 3.5 kilograms, was just born, is NPO secondary to respiratory distress. is ordered D10W at a rate of 10 milliliters per hour. We're asked to find the total fluid rate, or total fluids per day for this baby. Again, to find the total fluids, we take the hourly rate of the IV fluids, which is 10, multiply by the number of hours in the day, 24, and divide by the baby's weight, which is 3.5. Gives us 69 milliliters per kilogram per day. Let's look at an example with multiple IV fluids. Baby A is post-op day 1 from an abdominal surgery and is in PO. Is receiving TPN at a rate of 7.5, and for pain control has a fentanyl drip at 2 milliliters per hour through a double lumen PICC line. He also has a peripheral arterial line in place with a line flush, infusing at a rate of 1 milliliter per hour. His current weight is 2 kilograms. What are the projected total fluids per day for this infant? Again, we take each individual fluid rate, 7.5, 2, and 1, add those together, and then multiply by 24 hours in the day, divide by the baby's weight, 2 kilograms, and this will give total fluids per day, 126 milliliters per kilogram per day. Let's work on a practice problem. Baby A had a clinical deterioration with abdominal distension, apnea, and significant hypotension, and is now in PO secondary to suspected NEC. She has D10E48 infusing at 6 milliliters per hour and dopamine infusing at 10 mics per kg per minute, which is a rate of 2 milliliters per hour through a peripheral IV. For accurate blood pressure monitoring, a peripheral arterial line was placed and has normal saline heparin line flush infusing at 1 milliliter per hour. What are the projected total fluids per day for this infant? So again, we will add each individual IV fluid rate, 6, 2, and 1. So we have 6 for the D10E48, 2 for the dopamine, and 1 for the line flush. 9 milliliters per hour is your total IV fluid rate. Multiply this by 24 hours in a day. The total amount of fluid the baby will receive is 216 milliliters. Then we divide by the weight. It wasn't given in this problem, and I apologize for that. We'll assume 1.5 kilograms. So take 216, divide by 1.5 kilograms, and that'll give us 144 milliliters per kilogram per day. The next examples that we'll look at is glucose infusion rate. Dextrose-containing fluids such as D10 or TPN provide a constant infusion of glucose. This infusion is expressed in units of milligram per kilogram per minute, mg per kg per minute. It is important to know what this infusion rate is, particularly in scenarios when an infant is in PO or when dealing with abnormal blood glucose values. A physiologic GIR is between 4 and 6 milligrams per kilogram per minute. Below is both the shortcut form of the calculation that I use, as well as the derivation of the shortcut. For time's sake, we'll look at the shortcut version that I use, which is going to be here. You can spend time going through the derivation of that on your own, but basically it involves being able to use conversions to get to the appropriate units. The way that I look at glucose infusion rate, I take the percentage of dextrose, so whatever that D whatever is, times the infusion rate in mils per hour. Then I divide that by 6. This is the conversion factor that's explained in the derivation. And then times the weight. So let's look at an example. So baby A weighs 2 kilograms. He's receiving an infusion of D10 at 10 milliliters per hour. What is the GIR? So to find the glucose infusion rate, we'll take the percent of dextrose. D10, the percent dextrose is 10. multiply it by the rate, 10 milliliters per hour, and divide all of that by the conversion factor 6 times the infant's weight. So working those numbers, we get a glucose infusion rate, or GIR, of 8.3 milligrams per kilogram per minute. Let's work on a practice problem. Baby A is receiving TPN, which has a dextrose concentration of 15%. The infusion rate is 5 milliliters per hour and the infant's weight is 1 kilogram. What is the GIR? So here, we take the dextrose percentage, 15, multiply it by the infusion rate, divide by the conversion factor, multiplied by the infant's weight to give us our GIR. Here, working those numbers, is 12.5 milligrams per kilogram per minute. Now we'll move to look at combinations of enteral feedings and IV fluids. Many preterm infants receive a combination of IV fluids and TPN, IV fluids or TPN while enteral feeds are advanced. The total fluids per day then are the sum of the individual parts, which we've already learned how to calculate previously. So the total fluids per day is the sum of the NG feeding volume per day and the IV contribution. So we would take the NG feeding volume, milliliters per feed, times 8 feeds in a day, add that to the IV fluid rate, times 24 hours in a day. Then once we find the total volume for those two components, divide by the infant's weight. Let's look at this example. Baby A weighs 1 kilogram, is currently receiving a combination of NG feeds and TPN. NG feeds are at 5 mils every 3 hours, and the TPN is infusing at 4 milliliters per hour. We're asked to find the total fluid intake. So we know the feeding volume is 5 milliliters with each feed. There are 8 feeds in a day. So we would work those numbers. To find the IV component, 4 milliliters per hour times 24 hours in a day. We sum together those two components, divide by the weight. That'll give us total fluids per day of 136 mils per kilo per day. Let's work on a practice problem. So enteral feeds were just started on baby A, 27-week gestation and age infant, birth weight of 1.1 kilograms. She's receiving 3 milliliters of donor milk every 3 hours via OG tube. She has a double lumen UVC in place and TPN's infusing at 3.5 milliliters per hour, and there's a sodium acetate heparin line flush infusing at 0.5 milliliters per hour. We're asked to find the total fluids per day. So what we can do first is find the enteral components. So enteral, baby is getting 3 milliliters with each feed times 8 feeds in a day. 24 milliliters divided by the weight gives 22 milliliters per kilogram per day. And then we'll look at the parenteral or IV contribution. For this, we're going to add our rates and multiply by 24. So the rate for the TPN is 3.5 milliliters per hour, and our line flush is 0.5 milliliters per hour. Our total IV fluid rate is 4 milliliters per hour. We'll multiply by 24 hours in a day. And the total fluid contribution there is 96, but we still need to divide by the infant's weight, 1.1 kilograms. That equals 87 milliliters per kilogram per day. So to get the total fluids, we'll need to add together the enteral component and the parenteral components. 22 plus 87. 87. 109 milliliters per kilogram per day. Okay. The last part that we'll look at is how to work backwards to figure out the desired enteral feeding volume. So when ordering infant tube feeds, a specific feeding volume in milliliters is required to go into the order entry area. So while this is required for the order and for nursing to know how much milk they actually need to feed the baby, again, we think about introducing and advancing feeds in milliliters per kilogram per day. Recently in the NICU, we've been starting enteral feeds around 25 milliliters per kilogram per day and advancing those enteral feeds at 25 milliliters per kilogram per day increments when the baby is tolerating that. So day 1 will be at 25 mils per kilo per day, day 2 at 50, day 3 at 75, on to 100, etc. To find the NG feeding volume that you desire, you take your total desired fluids per day in mils per kilo per day, multiply this by the infant's weight. So we're working backwards. So this will then give us the total volume in a day. Then we'll divide that by the number of feeds per day the baby's going to have. Again, if the baby's eating every 3 hours, there's going to be 8 feeds in a day. Let's look at this example. You want to start enteral feeds for baby A at 25 milliliters per kilogram per day. The baby weighs 2 kilograms. What will the initial bolus feeding volume be in milliliters? And if he tolerates that feeding volume and you wish to advance by 25 mil per kilogram per day increments, what will the bolus feeding volume be tomorrow? So for the initial, we take 25 mils per kilo per day is where we want to start. We multiply that by the baby's weight of 2 kilograms and divide by the number of feeds per day. In this case, the feeding volume will be 6 milliliters. Tomorrow, if the baby tolerates this first feeds, then we can advance. 25 plus 25, or 50 milliliters per kilogram per day, times the baby's weight divided by the number of feeds per day. So in day 2, 50 times 2 divided by 8 will give us the feeding volume of 12 milliliters. Let's practice. In this problem, you want to start enteral feeds for baby A at 25 mils per kilo per day. His current weight is 1.5. What will the initial bolus feeding volume be in milliliters? And let's assume he tolerates the feeding well and we're able to advance his feeds by 25 mils per kilo per day increments. What will the feeding volumes be on day 2, 3, 4, 5, and 6? So to find day 1, again, we'll take 25 mils per kilo per day and multiply by the weight. 25 times 1.5. That gives us 37.5 milliliters that we're going to divide over 8 feeds in a day. This comes out to about 5 milliliters per feed. So on day 1, we'll get 5 milliliters. And since we know that 5 milliliters is 25 mils per kilo, then progressing through the next days is actually pretty easy. We would go to 10, then 15, then 20, 25, and 30 milliliters per feed. And each of those jumps is a 25 milliliter per kilogram per day increase. The last example we'll look at is working backwards to calculate desired IV fluid rates. When ordering IV fluids or TPN, a specific rate in mils per hour is required. Again, while this is required for the order entry and for nursing who programs the pump for the fluids, we think about fluid delivery in terms of mils per kilo per day. To find the IV fluid rate in mils per hour, we take the total desired fluids per day in mils per kilo per day, multiply by the infant's weight, and divide by 24 hours to get the hourly rate for the IV fluids. So let's look at this example. You want to start IV fluids on baby A, was just born, and is NPO secondary to respiratory distress. We want to start those fluids at 60 milliliters per kilogram per day. The infant's birth weight is 2.5 kilograms. What infusion rate of D10 are we going to start to provide the total fluids? Here we take 60 milliliters per kilogram per day, multiply by the infant's birth weight of 2.5 kilograms, divide by 24. This gives us an IV fluid rate of 6.3 milliliters per hour. Let's look at one final practice problem. We plan to start TPN on baby A. We'll be post-op from bowel surgery. We plan to write for a total fluid goal of 130 milliliters per kilogram per day. The infant's current weight is 3 kilograms. We're asked to find the infusion rate for the TPN to provide the total desired fluids. So, what we'll do is we know we want to deliver 130 milliliters per kilogram per day. We'll multiply this times the infant's weight, 3 kilograms. So the total volume delivered in a day will be 390 milliliters. We'll deliver this volume over 24 hours in the day. And so the hourly rate will be about 16.3 milliliters per hour. There may be other fluid scenarios that you find in the NICU, but hopefully this gives you a place to start to be able to calculate fluids that you'll need 4 rounds for the care of these babies. Thanks.